Hello everyone, and welcome to this audio podcast. This audio podcast is part of the Howl and Shiztorm. This audio podcast as part of the Ship Mode and Atom. This audio podcast is part of the Mayhem and Squad, and this audio podcast is part of a Storm Robotics production. Today we'll look at some of the diagnostic procedures for Crohn's disease or Crohn's disease or Crohn's syndrome, and in around some of the works by C. Jefferson, a pharmacology student within one of the academic institutions in the Midlands UK, and where C. Jefferson had articulated this works with in a collaborative effort. Sort of retrospectively, and so in as part of the diagnostic procedures for Crohn's, getting diagnosed for Crohn's can be a an arduous process due to the unpredictable flare-ups and presence or absence of complications. In the National Institute on Care Excellence or 2024 guideline around Crohn's or Crohn's disease, NICE 2024 had informed that Crohn's should be suspected in patients experiencing an unexplained abdominal pain for more than 6 weeks, and due to for example, adhesions and obstruction or inflammation, and other symptomology such as fatigue or anorexia or fever. When examining patients or healthcare service user with suspected Crohn's, according to NICE 2024, it is where patients can find that they might have mouth ulcers, tenderness, or where they have sort of anomaly or tissue inflammation in the right lower quadrant of the abdomen, and sort of anal fissures or strictures or narrowings, and signs of malnutrition or malabsorption, and abnormalities of joints, eyes, liver, or in around the epidermis or the skin. At the same time, if a GP or general practitioner, for example, suspects Crohn's, they should consider arranging a blood workup or blood investigations to understand the serum for blood count, a C-reactive protein, which is basically a C-reactive protein is, or CRP as is referred in context of the laboratory, in context of laboratory medicine or blood sciences, is where it's a marker for inflammation, of general inflammation, and can be used as a useful biomarker, or as sort of a marker to indicate inflammation. And erythrocyte sedimentation rate, which can become raised with active inflammation. serum urea and electrolytes, serum liver function tests, and serum ferritin, vitamin B12, folate, and vitamin D. Additionally, celiac serology to exclude celiac disease, and stool microscopy or feces microscopy to exclude infective gastroenteritis or pseudomembranous colitis, though this doesn't exclude Crohn's disease indefinitely. And then also looking at investigations in around fecal calprotectin, which may suggest active inflammation. Additionally, just to add here, or just to inform, that any one of these particular laboratory investigations, any one of these laboratory investigation that are conducted in solo, is not a definitive marker of Crohn's on its own. It is where Within the lab sciences, it is where there is a varying number of investigations that are done to actually definitively to definitively inform healthcare professionals that healthcare service users or patients actually are or would have Crohn's syndrome or Crohn's disease. So to confirm diagnoses, patients will be referred or would be referred to secondary care for secondary healthcare services for colonoscopy to allow for classification of disease and its severity. Images may include ulceration and or what's referred as clobberstone appearance and a magnetic resonance imaging, resonance imaging or MRI may be used, can be used in place of colonoscopy if it's not tolerated. Well, if it's not tolerated by healthcare service users as an alternative. Computerized tomography scans or CT scans are used or can be used to look for abscesses and fistula or narrowings, as well as ultrasounds. And again, any one of these any one of these radiological investigations on their own are not and may not ultimately rule out Crohn's as in solo investigations, and there is sort of context in amongst literature, published works, but also in around the works in around where in around NICE guidance or National Institute of Care and Excellence guidance from 2024. So that draws this audio podcast to a close. The next audio podcast will look into some of the pharmacotherapies, but the audio podcast won't go into any specific details on the kinds of and the kinds of drug names or drug brands or anything like that. There will be just an overview on aspects of pharmacotherapy in the next audio podcast. So that draws this audio podcast to a close. This audio podcast is part of the Howl and Shitstorm. This audio podcast is part of the Shit Mode and the Atom. This audio podcast as part of the Mayhem and Squad. This audio podcast as part of a Storm Lobostics production.